Andrea, thanks. Now, Steve Huffman, Public Information Officer for Mobile Fire Rescue, is on the phone now. Steve, talk about the kinds of precautions your folks went through when dealing with this patient tonight.
Well, Greg, we treat it like we would any infectious disease that we deal with on a regular basis. I mean, we deal with patients that have hepatitis, AIDS, different things like that. So infection control is not anything new to us. Obviously, this particular one is. But our guys, what would appear to some as overkill is not overkill for us, because we have to take every precaution to protect our people.
Now, Steve, we've been talking about this for the past 2 weeks since the first Ebola case here in the U.S. in Dallas was confirmed. Were your guys ready for what was happening today?
Absolutely. We had put out a set of guidelines, and those guidelines are not set in concrete. They can change as we learn about this. But the guidelines were put out. We've discussed it over and over. We've been putting out information over the past few weeks since this first case showed up in Dallas to prepare our people in the event that we had a case to show up here.
And as you look back on this, I'm sure there will be a debrief to look at what was done correctly, what was not done correctly, and you'll be able to report back to us on that. But as everything turned out tonight, no case of Ebola, and that is certainly good news, isn't it?
Yes, it is good news. But as I said, without knowing positively what you have to take these precautions, not only to protect the patient, but mainly to protect our own people, because we're no good to anybody if we're hurt or sick.
So true. All right, Steve, thank you so much. Great job tonight. Steve Huffman, Public Information Officer for Mobile Fire and Rescue.
Now, ironically,